really important to prevent Sharp's injuries because of the effect that it has on staff, on patients, and also for the trust as a whole. There are two ways Sharp's injuries can happen. One is whilst you're undertaking a procedure using a Sharp, but more often than not the injuries occur when people are disposing of Sharps, either actually at the point of treating the patient or once it's been disposed of. Thereafter, when someone's taking that away, they might also be injured if the disposal hasn't been done properly. There are other things like pressure of work, being distracted, not having a Sharps disposal box, the right one in the right place at the right time. But if they haven't done that, there is a higher risk that they will just throw the used Sharp into the bin. So it's a mixture of reasons. The picture is much bigger about how it affects people, and it is more often than not someone won't be infected, but they will have gone through a period of feeling really worried, of being depressed, of being lacking confidence, and it's all of that that also is part of the problem.
I've been a qualified midwife for well over 20 years. The needle stick injury that occurred for me was when I was practicing a midwife in 1992, and I was working on the labour ward. We needed to stimulate her labour. So the doctor came in and he cited a Venflon. He put a needle into her arm for some fluids and just some drugs to make sure we'd start the contractions off. The doctor did this and left the room. I decided to start changing her bed. As I went to take up the bed linen off the bed, I scooped it up and then I felt something sharp in the palm of my hand. I eventually went to the accident emergency and they counselled me. They told me about the risks involved, the risks of HIV. They also told me that because the woman that I was looking after already had a blood-borne virus, that they highly recommended that I start the course of PEP, or the antiretroviral drugs. So off I went home that night, started taking the medication. By the middle of the night I woke up, I had the most horrible pounding headache. I felt sick, I was having diarrhoea and vomiting. So once I knew that the client that I'd received the needle stick injury from, or the needle that had been left in the bed of the client, that they were HIV negative, I stopped taking the antiretroviral drugs. They did actually recommend that I take them for 3 months, but I felt so sick I could not envisage taking them for 3 months. And also I realised that if I'd had to continue taking them for that longer period, I probably wouldn't have been able to work. So I stopped taking them. And after the initial shock, you feel quite angry, and then you feel quite hurt, because although you know that the person would have done it deliberately, the fact remains that you're the one that's had the needle stick injury.
I come in as normal, went round, emptied the bins like I normally do, tied the bag up, pulled the bag to, and the needle went into my hand. Asked the sister to come over, she asked me what happened, told her, so she asked me to run it over the cold tap to make it bleed a little bit, and then she was checking the bag to find the needle, and then she asked me to go and book into A&E. When you go back to work, it makes you nervous because you don't know if you're going to get another needle in your hand or your leg or whatever, so you make sure there's nothing in the bin before you empty it. You've got to go and do it, because if not, you won't go back to work.
I was working in A&E. It's quite a busy environment. Again, like I say, no 2 days are the same. So you have to be on your feet, you know, but you still need to be following the procedures that you've had in your training. So this one particular day, again, overly busy. I was asked to go in and do a deep clean on a room. As I come to collect all the rubbish, had my gloves on, ready to put it into a disposal bag, and I noticed I had a pain in my hand. I looked at my hand and there was blood there. Sort of unravelled the tissues and there was a needle. My first reaction was shock. I think you always know that the risk is there, but you never really expect it to happen to you. Shortly after I had a little bit of treatment, it was known, or I did find out from occupational health, that this patient had passed away. That in itself is gut-wrenching. You've got so many questions of what did they die of, you know, have I contracted it, because I was still waiting for my results to come back. And then I started thinking of my life, who it would affect, you know, if I did actually contract something and it was life-threatening. You know, I have a child, and to think about him without a mother, you know, words cannot describe that. So to hear that before I'd even got my results back, yeah, it's definitely life-changing. I was really happy working in the job role that I had, and this has really put a massive cloud over it.
If you're disposing of a needle, where's your sharps bin, and making sure that it's nearby.
Every action has a consequence, and I think people really should think about their actions before, you know, following a procedure or doing a procedure.
The message to staff is that they should use a safety engineered device to reduce the risk of a sharps injury, and then when they dispose of the sharp, they should get rid of it immediately into the right sharps box, and they should dispose of it themselves.